Welcome to video number 4. In this video we'll be going over resources. For instance, when do you go to the ER? When do you go to your primary care? When do you seek a psychiatric provider? What is long-term care? And what kind of resources are there locally and federally? And how do you advocate for your children in the schools, in parent-teacher organizations, in the media, and in the legislature to make sure that they're safe? Okay, so first, where do you go? When is going to a therapist a good idea? So, going to a therapist is a good idea when there's no immediate danger or threat of harm. There's no suicidal plan, things like that, okay? It's also good when you're first noticing the signs and symptoms of depression and anxiety that we talked about in video number 2. That's a good time to find a therapist. Find a good therapist. What do I mean by that? Find one that your child can relate to, find one that your child can open up to, and one that when they do give your child or adolescents advice or opinions, they're actually going to listen. That's really important. That might take a couple changes of therapists. You might go through 3 or 4, and that's okay. You need to find the right one because that connection is really important. You can ask for referrals from friends and family. You can look online, of course, things like Health Grades, sites like that to see what kind of therapist it is. You can call them and ask them, what methods do you use? What are your specialties? What kind of experience do you have working with adolescents and anxiety? Things like that. And remember that therapy is first and medication is second. A lot of people want a magic pill to just fix things, but studies have shown over a really long time that therapy plus medication works the best. One or the other by themselves isn't as effective. So you really truly need therapy along with medication. And we'll go over resources if you just don't have the financial means. Okay. Step 2, providers. When do you go to a provider and who do you go to? So let's start with your primary care provider. So this is the person that you bring your kids to when they have a cold or for a checkup every year. That's that person. You want to go to that person when therapy is helping, but it hasn't resolved the issue. You want to go to them for uncomplicated depression and anxiety. So what do I mean by uncomplicated? Pretty straightforward. Isn't very convoluted. Doesn't have like weird symptoms or signs. Something that's pretty straightforward. Go to your primary care provider. So when do you go to a psych provider? Meaning a psychiatrist or a psychiatric mental health nurse practitioner like me. Someone who can rule out medical diagnoses, and someone who can prescribe medication when and if it's needed. When do you look for us? Okay, it's when you have more complicated issues, when you have a long history of cutting, past suicide attempts, you have concrete suicidal plans, and we'll go over that as well. You go to a psych provider when you have signs and symptoms of hallucinations, delusions, paranoia, psychosis, and of course, like we said, suicidal behavior. So what are hallucinations? Well, hallucinations are anything detected that would usually be detected by your 5 senses, so sight, smell, hearing, taste, things like that, but it's not actually based in reality. So again, anything that you would detect normally with your 5 senses but aren't based in reality. And I'll explain a little more, but they include visual hallucinations, audio hallucinations, tactile, which means feeling things, gustatory, which means taste, like I taste poison in my food or this tastes burnt, and olfactory, same thing, like I smell something burning, I smell smoke, I smell fire, I smell gas, but it's not really there. So the thing about hallucinations is they're greatly misunderstood. Hallucinations, although not based in the reality that you and I can see, are being produced by the patient's brain. So the brain is actually creating the sounds or the sights or the smells or the feelings. It's actually creating that. Usually it's pretty complicated, but a lot of the times it's too much dopamine. But although we can't see what they're seeing, their brain is producing that image. It's real for them. So be respectful of that. When you find out that your child or adolescent is having hallucinations, I know it's very scary, but you need to ask for specifics. What are they seeing? What are they hearing? What are they feeling? What are they smelling? You need to ask for specifics. Tell them to explain it to you, and that they're in a safe place, and you just want to help them and keep them safe. Okay? Ask for details, especially if there's something they're seeing or hearing. Ask, are they telling you something? Are they telling you to harm yourself? Or are there people? Explain it to me. You want to know specifics so you can understand how severe and how much of a threat it is. Now, there are things that are normal hallucinations, which I know that sounds weird, right? It shouldn't be normal along with the word hallucinations, but our brains are pretty powerful and they produce all sorts of images and sounds. What I mean by normal hallucinations are, there are hallucinations that happen when we fall asleep, because we start going into REM sleep, and they're called hypnagogic hallucinations. What is that? So if you've ever fallen asleep, and right as you're falling asleep, you hear something or you see something and you jump up, that's just your brain starting to go into that transition of sleep, and it's creating those images or sounds. That's fine, as long as it's not prolonged, as long as it's not telling you to do something or too vivid, it's fine. Same thing goes with waking up. How many of us have woken up and like, did you hear that? Did you see that? That's hypnopompic hallucinations. So that happens when you're waking up. Okay? Same thing. If it's prolonged, if it's telling you to harm yourself or others, or it's very vivid, then it's a problem. When do I go to the ER with my child or my adolescent? When they're having command hallucinations, meaning the hallucinations, usually auditory or visual, something they're seeing, is telling them to do something. So it could be telling them to set something on fire, telling them to turn the light on and off, telling them to shut a door, telling them not to listen to a person or to hurt themselves or others. If it's distressing, that's an immediate visit to the ER. Okay? You want to keep your child safe and get them the help that they need. What if they're having delusions? Delusions are false beliefs that are not necessarily based in reality. It could be something pretty big and dramatic, like someone could be deluded that they're a world-class actor, or they're a race car driver, or they're a supermodel, or this person's in love with them and is always stalking them. That's a delusion. That needs help from the ER. There's also things called ideas of reference, which kind of falls into the same category, meaning kind of delusional, where people think the news is talking to me, they're sending me secret messages, I have to collect these messages for the president to save the world. Delusions and ideas of reference. Paranoia. So paranoia seems pretty straightforward, but sometimes it's not. So it's the usual paranoia of this person's following me, this person's talking about me, this person's cheating on me, this person's taking advantage of me, they want to harm me. It's usually irrational and it's persistent, like over the top. You know, sometimes people just think, oh, that guy, I saw him following me all throughout Target. It's not paranoia. It has to be persistent, it has to be irrational. Psychosis. Now this is my favorite one to describe because it's not like in the movies. It's not like the term that's used commonly, like, oh, she's so psychotic, oh, what a psycho. Psychosis is just something that's not based in reality. So technically psychosis is hallucinations, delusions. It could also be disorganized speech or thought or behavior. So what do I mean by that? Well, let's keep it simple. Speech and thought that don't make sense. They can't finish a sentence. They're kind of trailing off. So they start with one topic and they don't finish and they go on to the next. And nothing's really connected. Not making very much sense. Or they're making stuff up, making words up that don't make any sense. Or they're saying words that do make sense, but it's not connected. Nothing's connected. So that's another example. Behavior that's inappropriate, so laughing at inappropriate times. They're telling you a sad story about how their mom died and they're distressed and they're laughing, or the opposite, they're smiling at inappropriate times or crying at inappropriate times. Their sleep patterns are weird, like they're staying up all night and sleeping throughout the day, or they don't need sleep, they don't want sleep, they don't want to eat, they don't want to get dressed, they don't want to take a shower. Things like that are concerning. There's also catatonia, so they're just sitting there and staring. Their movements are very slow. They might stay in weird positions for no reason, like moving their hands and legs in kind of waxy positions, and you don't know why. That's also concerning. That's a trip to the ER. And again, this is related to neurobiology and neurophysiology, things like dopamine that are causing these issues. They're not imaginary. Their brain is actually causing these issues for them. So let's go over suicide. It's the most common thing that parents ask questions about. And there's different aspects of suicide. So there's suicidal ideation, which means they're thinking about the suicide, but it goes kind of past that. So there's the thought of it, right? So they're sad, they're depressed, they're thinking that the world will be better off without them and nobody cares about them, so it doesn't matter if they're here anyway. It starts to affect like their facial expressions. They don't show joy anymore. They always look kind of sad. They smile, but their face doesn't reflect it. It could be suicidal thoughts that are constant. They could be fleeting, meaning it's a thought that comes into their head and then it leaves. It could be, certain times of the day, certain seasons, whatever. That's something that you want to seek help for at a primary care or psych provider. When it gets to intent, so suicidal intent, it gets a little more severe. If they truly have the intention of going through with the suicide, that's an ER or 911 right away. There's some people that say, I would never do it because I would love my family. I would never do it to this person. That's kind of what we call a protective behavior, but they still need to be watched pretty closely. Then you have suicidal means. So do they have the actual object to hurt themselves? Do they have any lethal objects? Guns, knives, lots of things are sharp. Do they have medication? Do they have rope? Things like that. You need to be aware of that. If they have the means and the intent and the thought, that's emergency care immediately. No questions asked. If they have a plan, 911 or directly to the ER. So some kids have pretty elaborate plans and they have several different plans if one falls through. That's really concerning. That's emergent care, especially if you start finding things that they're hoarding to go through with that intent. Our job as parents is to keep our kids safe. And ultimately, it's really how well we know our child. They can have a thought, intent, means, and plan, but does that child make bad decisions usually? Are they impulsive? Do they have risky behavior? Have they tried things in the past? Have they been harming themselves and it's just been getting worse and worse? Self-harm is pretty common, cutting themselves with objects. They usually do it on the inside of their arms. They'll do it on thighs, on their stomach, on ankles. So you want to look kind of in those places. And it's usually to get that release of dopamine to make them feel something, because feeling something is better than nothing. So you need to get your child help. Please don't feel like an inadequate parent. This is a threat to your child. It's outside of what you know and what you can handle. Go get help. They need it. The goal is to keep your child safe, to get you help so you know how to deal with it. If for some reason you can't get help right away, make sure that your home or wherever your child is really, really safe. Meaning, if they're cutting themselves or threatening to hurt themselves with some kind of sharp object, hide all the sharp objects. You have to think really outside of the box, because when people are very upset and very depressed, they think outside of the box and they get desperate and they'll use anything that's sharp. Put away scissors, even child scissors. Put away razors. Put away anything sharp that can be used to harm them. Lock them up. Put them away. Think of things that can be used for hanging, unfortunately, like scarves, hoodie ties, shoelaces, sometimes hair ties, anything they could use to ingest antibacterial lotion, Tylenol, rubbing alcohol. Tylenol is lethal in large amounts. Please hide it. Also, if you have to keep them safe at home, there's no closed doors. If you have to take the door off of their bedroom, take it off. You need to go with them to the bathroom. They can't sleep on their own either. You need to be in the same room with them. Set up booby traps so you know if they move. Whatever you need to do. But these are things and precautions that are done in the hospital. When they have to go to a psychiatric hospital, they're not allowed anything that can harm them. Someone is with them all the time. They cannot go to the bathroom by themselves. There's cameras in their rooms to make sure they don't harm themselves. This is the precaution and this is the level that you need to go to at home. And it's not extreme and it's not dramatic. It's keeping your child safe. If they're acting dangerous, if they're acting violent or erratic, totally not like themselves, or it's something that you feel you just can't handle and there's an immediate threat, call 911. Now I say that, but I want you to keep in mind that the first responders that come, paramedics, firemen, policemen, they're professionals there to help you, but they're not psychiatric providers. So give them a break. They're doing the very best that they can. They'll get your child or your adolescent to where they need to be to keep them safe, but remember that they also have a priority to keep themselves safe. They have family and they have children of their own often. They just want to go home. So please help them. Don't escalate the situation. And lastly, something that I tell families and kids that I talk to all the time is that mental illness is no different from physical illness. If I have asthma and I'm having an asthma attack and I pull out my inhaler, no one's going to smack it out of my hand and tell me to stop being dramatic and just buck up and deal with it. Mental illness is no different. This is not 1751. We know a lot more about neurochemistry and neurobiology. We now know that depression, anxiety, and psychiatric illness, it's not just behavioral. It's physiological. It's something that sometimes we can't control. And yeah, sometimes it's genetic. They need help. They deserve help. And they don't deserve judgment. So please seek help for them. Now, what is long-term care? So sometimes kids go to what we call residential treatment centers, where they live there and they receive care and supervision 24 hours a day. When do they get that? Usually when their signs and symptoms don't improve with medications or therapy, or they've failed certain medications, meaning that the medications really haven't worked for them, and other methods of treatment, haven't worked. That's usually when they go to these residential places. And the residential places usually take a referral from a provider for them to go. You usually can't just walk in. You have to get referred there. Local resources. So in Nevada, we have lots of local resources and hospitals, emergency places that you can take them, not only just to general hospital, but psychiatric emergency hospitals that you can take them to get immediate help. I linked some below and I listed them to the side. If you don't have the financial means to get your kids help, there's lots of different programs and lots of different places that you can still go. Here in Northern Nevada, there's the Children's Cabinet. They're amazing. They have lots of different programs and it's free of charge to go get your kids therapy or help that they need. Don't hesitate to contact them. So lastly, it's important to advocate. We need to prevent it. We need to not just react, we need to prevent. So what does that mean? That means talking to your school district about bullying, setting up safety teams or prevention teams of parents and professionals to go over incidences that happen and to plan anti-bullying tactics. It also means going to your parent-teacher organizations, PTOs, PTAs, telling them you're concerned, seeing if you can get a provider in the area to go talk to the parents about what to look for or resources to help. Go to the school districts, tell them you're concerned, tell them you want help, and then be willing to help them do that. The key is to advocate for prevention. Stand up for your kids so they can stand up for themselves. And as providers, be aware. Be aware of the dangers. Be aware of the signs. Be an advocate for your patients and your clients. Thank you so much for watching these videos. If you've missed any of them, there'll be links to video 1, 2, and 3 below. And again, comment with anything that you liked and anything that you feel I didn't cover that maybe you need to know a little bit more about. And remember, be nice. We're not cyberbullying on this site. Thank you so much for watching.